is I'm going to start from the beginning to end. So I'm going to do exactly what I would do if I was walking into a patient's room. So as you walk in, you're going to introduce yourself. You're going to say, hi, my name's Kayla. I'm here to draw your blood today. And then you're going to, if you're in a hospital, you're going to check their armband, scan it. Then you're going to check their information, whether you're in outpatient, inpatient, you're checking their first, last name, and their date of birth, always, okay? Once you've confirmed that, you go ahead and you go get some hand sanitizer, sanitize your hands in front of the patient always, or wash, whatever you feel like you can do. Then, you're going to go ahead and set up your supplies. Mine are already set up here, so make sure you have everything within your arm's reach of your hand that you're not going to be doing the blood drawing with. And then you'll go ahead and put your gloves on. Then we're going to go ahead and check for our vein. So we're going to go into this side. And you always want to try and check both arms just to double verify where you're going. But if you find a good vein in the first arm, it's totally fine to go with that first one. But sometimes you can check, but she's already had just stuck on this side, so I'm not going to check for this one. So this side is going to be the side we go into. So right here is a really nice vein. It goes straight up and down. Has a little bit, kind of goes that way a little tiny bit, but this is where you would want to go. So go ahead and feel right there.
Oh yeah, I feel that.
Yeah, you feel,
Yeah.
feel how it kind of has that water balloon kind of feel. That's exactly what you're looking for. It's something that's squishy and it bounces back at you. So once you've found your vein, you just let that hang. Then you're going to clean your sides and always using concentric motions. So starting from the center, working your way out. And that helps the bacteria start from in the middle and then you're going to work your way out. So you let that air dry. And then as you're letting that air dry, you're prepping everything. So making sure this is screwed on really nice. You have everything within arm's reach. Let me grab another tube so we can I can show you how to do switch placement. And then we are gonna go ahead and retie that tourniquet. And we're never gonna double touch, okay? So don't ever double touch, even if you clean your finger or anything like that. Once it's clean, it's clean. If you touched it, you need to re-clean it again, okay? Just like you did the first time. So tie your tourniquet. Make sure it's about 4 inches or so. I always say like just one palm size above, so it keeps everything out of the way. Then we're checking our needle, making sure there's no defects, no fluffs or anything on it. Make sure their arm is in a position where you feel comfortable. So downward is always better because you'll get a better blood flow. Then you want to anchor that vein. And the reason why you anchor that vein is so that it's nice and tight and you don't have any pushback when you go in. So then you go in, push. You see how I went in about 1/4 of the way? I'm going to fill this all the way up because we're going to use this for the centrifuge right now. And you'll tell when it stops because it literally, you won't see anything moving in it anymore. And then you'll grab it with your middle finger and your thumb and you'll push back on the hub with your pointer finger. And then when you push in with the second needle, you'll push in with your thumb and grab the hub with your middle and your pointer finger.
Push it in with that one?
Yeah, like this.
Okay.
You'll push in like with your thumb.
Okay.
We're not going to fill that all the way up because we don't necessarily need that. Then, so it's tube, tourniquet, then your gauze, then you press, ask them to hold, activate your safety. Go ahead and hold for me. Toss that immediately. You never want to step too far away. You want to make sure you activate your safety, throw that away. Invert your tubes. And I always say just invert them about 10 times because it just covers all the aspects of your tubes. So whether you have like one that needs less or more, it's better just to do the amount that needs more, okay? Okay. Then as you are having them sit there. You're always going to be filling out your tubes or whatever needs to be done. So obviously there's going to be either labels that are pre-labeled with their name and they print out and whatever, or you have to fill it out manually. So you're going to fill their first, last name, date of birth, your initial, the military time, and then if you have an ID from wherever you're working, you'll go ahead and put that on there as well. Fill both of those out. Usually by that time they've sat there for about 2 to 3 minutes. Then it'll say, I need to check. She is a pretty quick, she stops bleeding pretty quick. So go ahead and hold that for me again. We're gonna grab the tape. And she is good to go. And then you thank them and tell them to have a nice day. And that's it.